Good morning, everyone, and welcome. My name is Mike Jones, and I will be your host for today's discussion. Thank you, everyone, for joining us on a topic that is always important, but even more critical in Florida today. My name is Mike Jones. I'm the president and CEO of Molina Healthcare of Florida. We are proud to serve Floridians with top-rated healthcare, and just as proud to celebrate those in our communities who are making a difference every day. As part of the MolinaCares Accord, our community investment platform, we are presenting this virtual panel, Behavioral Health in the Aftermath of Hurricane Ian, to discuss an issue that has impacted and will continue to impact the behavioral health and well-being of so many Floridians. We are recording today's event and we'll be posting it online at MolinaCares.com. We encourage you to share the recording with interested parties who weren't able to join us today. All participant lines will remain muted, and attendees are encouraged to submit questions through the Q&A or chat feature. And we'll do our best to group similar questions and ask our panelists if there's time before the end of the conversation. Research shows traumatic events like these have repercussions far beyond the physical damage and destruction that we have seen, especially related to emotional and mental health issues far into the future. According to the Florida Behavioral Health Association, mental health providers are still working with families affected by Hurricane Michael back in 2018. While we appropriately focus on the survivors of these catastrophic events, the public may not realize the toll this also takes on our first responders. Before we move into our discussion, I'm excited to share remarks from our keynote speaker, Chairman Sam Garrison. State Representative Sam Garrison was elected in 2020 to represent Northern Clay County and won re-election last year. Even prior to joining the legislature, his passion for serving his community was evident. No surprise given the long line of teachers that come from his family. Chairman Garrison joined the state attorney's office as a prosecutor nearly 20 years ago and has worked with local law enforcement to establish Clay County's first rape crisis center and has also served as the chairman of Clay County Task Force on Sexual Assault and Domestic Violence. Recognized by his peers in the Florida House, Chairman Garrison is in line to become the Speaker of the House in 2026. We'll now hear from Chairman Garrison.
Thanks, Mike, for that warm welcome. I really appreciate it. This is Representative Sam Garrison. I want to also thank Molina for your support and the great work you do on behalf of Floridians. I could talk about mental health issues all day and what we do in the state. There's some great things that we can talk about, some strides we've taken in recent years. But I really just want to speak to you from the heart about why mental health issues are important to me and why this should be important to the state. As we come out of the pandemic and especially, live through hurricanes that we've dealt with this past year and just life in general, we see that the mental health needs of Floridians they're real. And there's a lot of work that needs to be done by a lot of different folks to take everyone pulling in the same direction. My dear friend is the director of mental health for our local county school district, and my wife's a teacher. My mother-in-law is a mental health counselor, and I've got two teenagers. So combine all those things to one, and I've got a pretty good grasp of some of the mental health issues that are really pervasive in our society right now, especially as it relates to teenagers and young adults. So whether it's really acute issues that require direct need or long-term preventative care for our teenagers and young adults as we kind of move into this post-COVID world, it's real important that we as Floridians do everything we can to make sure that we are building and sustaining a resilient society, not just with what we do with brick and mortar issues, but mentally and behaviorally, and the work that behavioral health folks do to provide those services to all Floridians, regardless of their where they come from or their income level, is really important. So I want to thank you all for your support. It's an exciting time for those of us who are engaged in this issue. Certainly the work the First Lady has done has been rocket fuel to this issue, and we're seeing some real bipartisan leadership on this front. And we're excited to work with First Lady DeSantis and our colleagues in the legislature and with our partners throughout the state to make Florida not just one of the a leader economically in other areas, but a leader in how we cultivate resiliency in terms of behavioral health, strengthen our families, strengthen our communities. So thank you for that work. Thanks for what you're doing. And just know we here in the Florida House are excited to partner with you as we move forward. God bless. Take care. And thank you again so much. Look forward to seeing you all in person very soon.
Thank you, Chairman Garrison, for those remarks. We have all been through a lot in recent years, the pandemic, uncertain times in our country and our world, and 2 hurricanes last year that disrupted the lives of millions of our fellow Floridians. While the recent holiday season brought joy and comfort to many of us, it can place an extra strain on our friends and neighbors who are struggling. We at Molina Healthcare join partners around the state to work together to improve Floridians' health and lives, and that includes their behavioral health. We are all in this together. Each of us has a particular skill or tool unique to every individual that we can use to help others with behavioral health issues. And I am thrilled to have such an esteemed group of state experts joining us today to talk about these issues and solutions we can implement. With that, allow me to turn over to our moderator, Kimberly Moore, a journalist and published author who for decades has covered both national and state issues. Just last year, the 25-story series on mental health in the Lakeland Ledger won her numerous state awards, including the Florida Society of News Editors' First Place Award for Community Leadership. Kimberly is currently a reporter with Lakeland Now, covering news in the Lakeland region. Kimberly, thank you for your continued coverage of this important issue.
Thanks, Mike Jones. And I do want to thank Molina Healthcare of Florida and MolinaCares Accord for bringing all of us together today so we can talk about this really important subject. And I wanted to introduce our panelists today. Our first panelist is Melanie Brown-Woofter, and she is the president and CEO of the Florida Behavioral Health Association. With more than 70 provider members and close daily work with many state and local agencies, the association plays a critical role in aligning best practices and resources statewide. Our second panelist is Sheriff Dennis Lima. Our first responders are heroes for their 24/7 presence to help during the most difficult of times. Seminole County Sheriff Dennis Lima can tell us about how law enforcement and officers cope with the after effects of high pressure public service. And our third panelist is Melissa Larkin Skinner. Melissa Larkin Skinner is CEO of Centerstone in Florida and has more than 25 years of experience in mental health care, including direct work with patients as a practitioner. So on behalf of Molina, we thank each of you for all that you do to make sure Florida has the opportunity to live a happy and healthy life, each person in Florida. So our first question goes to Melanie, and I wanted to share some statistics out of Polk County. We did a study recently. 1 in 7 of our friends, neighbors, and coworkers struggle with depression. And one of the most alarming statistics that I saw in this report is that 17% to 24% of students, depending on their age, have thought about suicide. And we've seen many significant events over the past few years, from the pandemic to Hurricane Ian, that have changed our lives dramatically. Melanie, what is some other research and data that show how these things have affected Floridians' behavioral health?
Well, thank you, Kimberly, and thank you to Molina and to our panel members for being here today. You're absolutely right. We were forever changed by the pandemic. We now have the hurricanes and other disasters, and so our mental health has definitely been impacted. So anecdotally, we feel and we know from the hurricane that there has been depression, anxiety increased among our neighbors and ourselves, but we now have longer term data to show the impact of natural disasters. In 2020, data was released by the University of Delaware that studied 281 natural disasters, including hurricanes, and found for 12 years, and found that the rate of suicide increased by 23% after those natural disasters compared to prior. We also know that when Hurricane Katrina hit in 2005, over half of the survivors reported depression and anxiety, changes in their mental health status. And we also know that 5 years, and in 2018, we had Hurricane Michael in the Panhandle, and Bay County schools have recently released data that showed 72% of the students and faculty have expressed depression, anxiety, and emotional trauma post-hurricane. So now we have the data to show what the long-lasting effects of these natural disasters are. We also want, in terms of our current situation, not only do we have the natural disasters, but we have the overlay of the opioid epidemic and the increased fentanyl that is just being poured out all over, and how fentanyl is being laced with many other drugs, and unfortunately folks aren't aware of this and are having problems with it. We are seeing that from August 2021 to August of 2022, preliminary data shows over 8,000 drug-related overdoses in the state of Florida, and 2 years ago, for the first time ever, we had over 100,000 overdoses in the United States. When you couple that with the rates of suicide increasing among all age groups, adolescents, those 45 to 55, our seniors and our veterans, and our first responders, it is a time of unprecedented demand and need for mental health and substance use services.
Melissa, you work closely with Floridians struggling with their behavioral health. How has the landscape changed in recent years in terms of demand for those services, and how much of that is attributable to significant events like the pandemic and Hurricane Ian?
Well, as Melanie mentioned, demand has certainly increased significantly. And I'm a glasses half full kind of person. So there's the immediate trauma, the acute stress, the loss, the uncertainty of events like the pandemic and a hurricane. And then there's also the chronic stress of, well, when is it going to end? What's next? What's going to hit me next? When are we going to recover from this? When is the community and when is my life going to go back to how it used to be? But with that and all those challenges, and as distressing as that can be, we also see a reduction in stigma. The reduction in stigma has increased tenfold. And that is incredibly important, because what that does is it helps people become more comfortable with the idea of, we all experience stress, we all experience trauma, we all experience depression, anxiety, and grieve. We all grieve. And it makes us more likely to reach out for help. And there is help from organizations like mine and all of my colleagues across the state of Florida. The other thing it does is it brings us strength. When we survive, despite the distress and the stress and the trauma, we become stronger as human beings. So I think I always try to focus on the positive. There's a lot of negative, but focusing on the positive is one of the things that helps us get through it.
And I know providers are in demand. Here in Polk County, it's one provider for about every 670 people. The state of Florida, actually, I'm sorry, that was the state of Florida. It's 1 in 670. Here in Polk County, it's one provider for about every 1,200 people. And the national target is about 1 in 310. We're going to move now to Sheriff Lima, who most people don't realize that county jails here in Florida are the largest providers of mental health care and stabilizing people who've been taken into custody. So Sheriff Lima, law enforcement are the first responders during natural disasters. Can you talk about some of the unique experiences and challenges that law enforcement deal with during these difficult circumstances like Hurricane Ian, especially when interacting with citizens who have faced really traumatic experiences, losing their homes, maybe losing loved ones?
Yeah, be happy to. Thank you so much for having me on. And the policing voice is so incredibly important as we address this across our state and our country. And Melanie and I have done a lot of work in this space, and we've identified that crime is a symptom of another problem. And towards the top of that list of untreated problems in many spaces is the mental health crisis. We've already heard before, as we shifted in policing, we've experienced a lot of different things in the past decade or so. You know, the unintended consequences of COVID, and not a political statement, but the unintended consequences of COVID, of wearing a mask and sheltering in place, is people who are already in recovery from substance use disorder turn back to their substance at greater numbers than ever before. And then we've seen the co-occurring, co-present mental health conditions that go along with that. I think we've seen deinstitutionalization across the country. And that means a lot of people who are in need of help and services end up on the streets, in homeless camps, and ultimately in our correctional facilities. Specific to the natural disasters, when you take all of these combined challenges that are on first responders, like the fact that first responders only here in the state of Florida are deploying the life-saving drug naloxone thousands and thousands of times each year, or quite literally, bringing people back to life from death. You have the concerns of like compassion fatigue that's going across the country, and it's one thing leading upon another. When these natural disasters come, the hurricanes, we saw it with Ian, we saw it with Michael. These first responders are leaving their families, going out and serving other communities when many of their own personal homes have been devastated. They worry about their families that are at home, but yet have to have the cognitive ability to move forward and protect and serve others. And when those crises go on, sometimes it's the relationships that we build through venues like this with Molina and others that will get citizens the help and services that they need. Lastly, we've been a profession for a good number of years that subscribe to this mindset that big boys and girls don't cry, right? If you're in policing, you can't ever talk about how you are emotionally. And I think that we've really warmed up to the sensitivity of understanding statistically, police officers across this country have one of the highest suicide rates. A lot of that stuff is built upon from the trauma that they see over the years, and having resources and people that we can talk to is so incredibly important. And I want to thank First Lady Casey DeSantis, because we worked very closely with her as soon as Governor DeSantis took office and they moved into Tallahassee. They had roundtable discussions, and they have raised millions and millions of dollars to help support the unintended consequences of these storms. And a lot of that money have gone to first responder families as well.
Melanie, I wanted to talk to you about things that trigger and conjure up stress. Can you tell us more about this?
Sure. So, after a disaster, we have that immediate impact when there's a surge of adrenaline, the community comes together, the governor deployed emergency operations center resources. We had law enforcement officers respond. First Lady Casey DeSantis has set up a program for first responders and mental health. All of those resources are available. And then after that, after that immediate impact, the electricity is restored, transportation is somewhat restored. Then we have to go back to everyday life, and things are different. People suffer with the anxiety of, when will my roof be fixed? When can I move back home? When will my neighborhood be cleaned up? When will my favorite restaurant be open again? My favorite spot to go to have a picnic on the beach is destroyed. When will that be cleaned up? And so all of those factors, come together to create that depression and that anxiety. And they also create triggers so that in the future, when you hear the wind blow, or perhaps you smell smoke because there were fires after the hurricane, it can trigger that response. And especially for law enforcement and first responders, Sheriff Lima has long been a very forward-thinking sheriff and a champion for mental health and services for law enforcement as well as the general population, because they're the first ones on the scene to see that devastation and to have to rescue people, dead and alive, unfortunately, from the rumble. And that just leaves a lasting imprint on our brains. And also, I'd like to add that people are grieving now. They've experienced loss, either family members, friends, loss of their homes. And so the grief process is not linear. And so sometimes grief is immediate, sometimes it's in the future, 6 or 8 months away, and it comes in waves and in cycles. And so it's going to take folks quite some time to be able to sort through that grief process and to be able to move on, with their lives.
Melissa, you've had the opportunity to directly work with those in need of behavioral health care support, but that can be daunting. And I want to personally thank you for the work that you do. What would you tell someone who believes a friend or family member needs help?
Well, thank you for asking that question, Kimberly. And the big thing is empathy, being able to have empathy for others. As you mentioned, the statistics about the availability of providers to the number of people who need them is dim in many ways. There just aren't enough of us to go around, which makes it even more important as friends, family, community members that we support each other. So empathy is the big one, listening to people and accepting how they feel, not telling them they shouldn't feel that way or they should be over it by now. Even people who maybe aren't exhibiting that they're feeling any loss or that they're grieving, telling them they should be. You don't want to do that either. Just take it for what it is. Just listen and be there. The other thing is you can't take it away from them. We can't take grief and depression and anxiety away from people. We can support them. So also managing kind of your own expectations about what you're going to be able to do for another person. And then showing compassion, and compassion really is empathy plus taking an action. So become knowledgeable about the resources available, become knowledgeable about anxiety and depression and its prevalence, what it looks like and how you can help, and share that information. Share it with whoever you think it's important that they should know it. Another opportunity that most communities have is there's a provider organization or some healthcare organization that teaches a course called Mental Health First Aid. And much like the first aid most people are accustomed to, that tells you how to stop bleeding and things like that. Mental Health First Aid helps you identify that someone may be experiencing a mental health issue or crisis, and then tells you how you can respond. So I would highly recommend that for anyone that lives in a community that it's available.
And of course, there is a new national hotline now for mental health help. It's very simple, 988. And if you or somebody you know is experiencing a mental health crisis, all you have to do is dial 988 and they will put you in touch with someone to help you. Sheriff Lima, law enforcement officers are often the first contact for a Floridian experiencing a mental health crisis. Can you tell us how officers are prepared for these encounters? I know here in Polk County, Sheriff Judd has his people go through a lot of training.
Yeah, I think we're in the midst of a shifting paradigm when it comes to the policing profession, not only here in the state of Florida, but across the country. We have become more sensitive and mindful of people who are suffering, whatever type of health condition that exists. And, we have CIT training, which is a kind of a prerequisite for any police officer that's coming onto the job at an overwhelming amount of agencies across the country. But even back 30 years ago, when I started, you would find somebody that was in a mental health crisis. There was only really 3 options. And the most used option at the time, again, we're going back 30 years ago, was to put somebody in the back of your patrol car and drive them to the county line and say, hey, walk south. And if you come back, we're going to take you to jail. Incredibly insensitive, right? I think that with this shifting paradigm, we're looking at substance use disorder and mental health in the same spirit that we looked at the comparison to prostitutes 20, 30 years ago. Prostitutes were going to jail. It wasn't until we became more aware and mindful of human trafficking and the needs where we actually shifted and started to treat them like victims. So I think that the policing profession is really leading the charge with this attitude of mental health condition is not a situation of trying to make bad people good, but rather sick people well. And we're using, the sheriffs across this state are using their political capital with the legislative process to create new initiatives that actually help people recover and get into some treatment. To Melissa's point, there'll never be enough bed space available. And sometimes we hear, well, there's not enough beds. Yes, there'll never be enough beds. And this is why providing outpatient treatment services in an environment that is most comfortable for the patient is so incredibly important. And making people aware of these medical conditions. Let's face it, if the average person in this generous society saw somebody in a restaurant on the side of the sidewalk experiencing a physical medical condition, we would run over there and render aid to the best of our ability. At bare minimum, we would call 911. We would get somebody else more qualified to provide help. But sadly, because we have created this trauma associated with insane asylums and mental health conditions, where most horror movies and Halloween events centered around people who suffer from this, many people turn their heads and look the opposite direction from somebody demonstrating a mental health episode because they're fearful of the unknown and they don't understand it. So I think that as a profession, we've become more sensitive to that. And we're using every aspect of our political capital to leverage additional resources to help close the gap and get people the help that they need.
And honestly, I have heard nothing but good things about your department. It's something in the state that people hold up as an example of how to deal with people in a mental health trauma. And I wanted to remind reporters and guests out there, if you have a question, please use the chat feature, type those up, and they will be shipped over to me. Melanie, are there any new innovations in the delivery of treatment that we'll see in the future?
Yes, we are seeing some exciting new partnerships and collaborations in the community so that we are able to address mental health needs, address the entire person. To Sheriff Lima's point, a mental health diagnosis is a medical diagnosis, and a mental health crisis is a medical crisis. And we are seeing a shift in how we view that and how we treat that. So, to that end, we're looking at the advent of integrated models. When I say integrate, they integrate mental health, substance use treatment, and primary care. Integration and realization that the number of co-occurring diagnoses with both a substance use disorder and a mental health disorder that are there. We've seen the increased use of telehealth. And so now we're looking at adjusting that mix to see what is the ratio of in-person services to telehealth services. We're looking at the use of apps and AI as well as digital therapeutics and treatment. We have new medications that are out. We also are seeing new teams or crisis response teams really in co-response. So law enforcement and behavioral health ride together to respond to 911 emergency calls so that the ones that may have a behavioral health component. And we're seeing great success with that, almost an 80% diversion from an inpatient stay. We're seeing an increase in the outpatient community services as well as short-term residential. And we're also seeing new models in Florida like the Certified Community Behavioral Health Clinic, or CCBHC, in which community partnerships are formed to create a full system of care that is able to address housing supports, food insecurity, outpatient and inpatient services, prevention, primary care. All that comes together so that the community is supported and the individuals in that community are supported as well. We're also seeing increased distribution of Narcan so that we can resuscitate those who are in an overdose situation and then perhaps do a warm handoff to get them into treatment. So there's lots of opportunities out there. There's lots of innovation that's happening in Florida and across our nation.
I think with, during COVID, where we were all squirreled away for a while in our homes, and we became more comfortable with things like Zoom and visiting with professionals online. So tell us maybe how telehealth has helped to lift the stigma of reaching out for help.
So, telehealth was implemented almost overnight across the board in community behavioral health. And so you're right. We are seeing folks are certainly becoming more comfortable with Zoom, with talking on their phone to a professional, especially adolescents are really very comfortable using their cell phones to be able to communicate. And so we're seeing a lot of uptick in use of that and some success in that as well. Now, obviously, if you're in a crisis situation, you probably will need to be treated with someone in person. But for those with mild anxiety, mild depression, who just want to talk to someone, telehealth is certainly an avenue to be able to reach that service more quickly than perhaps in an in-person situation. And we're also seeing, I'd like to say too, to Melissa's point, over 3 million Americans have been trained in mental health first aid. And we're seeing that providing that tool so that individuals know how to start a conversation, know the words to use, know the signs to look for to refer someone, to talk to an adult or to a professional about their neighbor or their friend has really been useful as well.
Okay. Melissa, what are some of the warning signs that someone's having a behavioral health issue that friends, family, coworkers can look out for?
So everyone experiences emotions a little bit differently. Everyone experiences the events of life, the traumas differently. So it's important to acknowledge that we're not going to be exactly alike. I think Melanie talked about it earlier, just the grieving process. For instance, some people will move through grieving a lot faster than others will. And we have to acknowledge, first of all, that that's okay, because we're all different. That's what makes us interesting, right? But really what you look for is any change, any significant change in behavior. The things that we really look at are sleep. And most people probably think about, they've probably heard that, oh, if a person is depressed, they're going to sleep way more than they normally do. But we also look for whether or not people are sleeping less than they normally do. Are they having trouble falling asleep, staying asleep, or perhaps not sleeping at all for several days in a row? Another thing we look at is appetite. Have eating habits changed? Are they eating much less, like maybe one meal a day or even nothing, or a snack in a day? Or are they eating snacks all day long? Anything that's significantly different than it was before they started noticing a difference. Has there been a change in attitude or how active they are every day? So have they stopped going to work, or are they working constantly, like working on weekends, working on nights, working their normal hours? Or have they stopped working at all and they're just calling in sick and saying, sorry, I can't work, or not showing up for meetings? Are the leisure activities the same? If somebody really loves reading, have they stopped reading altogether? Or video games, or playing sports, whatever it is that someone enjoys. And then another thing to look at is their health overall. Do they have headaches that they maybe didn't have before? Are they more frequent? Maybe high blood pressure is a sign, that something we need to look at. Are they experiencing a blood pressure issue that they had never experienced before? And how are their relationships? Are they having any relationship problems that we never saw before? What seems like maybe a healthy, comfortable relationship, is it different now? Is the person irritable all the time and not having that strong connection to people like they did before? Or maybe they just stopped calling people, stop going out with their friends, stop inviting people in their home, which is different than before. And then, of course, looking just at physical appearance, how someone looks can tell you a lot if it's different than how you know them to have looked before. So just one example is somebody, like if it was me, people who know me and see me all the time know that when I go to work, I'm generally dressed in a suit. I have a little bit of jewelry on, I have makeup on, and my hair fixed in a certain way. And if that changed and I stopped those things, and maybe I just pulled my hair back in a ponytail, I didn't put makeup on, I didn't wear a suit anymore, maybe I just threw on jeans and a sweatshirt and went to work, someone would know something changed with me. And my hope is that if you ever notice any of these changes in a person you care about, that you ask them about it. ask them if everything is okay.
Sheriff Lima, I wanted to shift to you. So in the last several decades, and it actually started under President Kennedy, the large mental health hospitals that maybe we've seen in movies, those have closed as, different presidential administrations tried to move mental health care to communities. There have been some Supreme Court rulings that you can't hold people for longer than 72 hours if they're not a threat to themselves or others. You cannot force people to take medication. So what are some of the resources that you all have in law enforcement to support those dealing with a mental health crisis?
Yeah, so we have a lot more resources now. And, I hear people saying all the time that a lot of homeless people are mentally ill. And I remind them, I said, true, but reverse the order. A lot of mentally ill people become homeless because there's absence of resources, there's nowhere to go. And I think what we've done is we've become incredibly mindful that correctional facility is not the most desirable space to treat people with chronic mental health disorder. I mean, we do the best we can. And I would argue that sometimes we are, the more innovative facilities are on par with what goes on, but that's not the place. So we need to divert people from the traditional criminal justice system when we can to proper placement in mental health services where people are licensed and trained to do that as their specialty. And I think that the people in the mental health space have been incredibly generous to the people in the policing space. And I intentionally use the word policing instead of law enforcement, because I think that sometimes we get the reputation of being overly enforcement related when effective enforcement is just one aspect of good, effective policing in it itself. But you've been incredibly generous with us. You've allowed us placement on many of the boards on the mental health commissions across the state. You've come into our correctional facilities. You've helped with the advocacy for things like problem-solving courts. Back 20 years ago, you never saw this, but now we have mental health courts across this state where people who are not competent, they can't stand trial, have some resources. The last thing that I'll say is a little critical on the past practices of the criminal justice system, but we've disproportionately treated people based upon what their mental health condition is. Like, we know that you don't get to pick what you have. And if you suffered from late stage memory disorder, whatever that was, the criminal justice system treated you with a level of kindness. Like, they documented your name. They said, if you see John Doe wandering the streets, he lives at this particular location. If he's accidentally walked into a neighbor's house, very rarely is that person ever going to jail. But if it's a different mental health condition that manifests itself at a younger age, and it's paranoid schizophrenia, for that example, we know that those encounters are disproportionately more likely to end in violence, either them hurting themselves, somebody else, or having a negative encounter with policing professionals. So making sure that we are informed to the level that HIPAA allows us to, voluntary databases, connecting in community policing with the family is so very, very important. And then lastly, we need to get back in the state of Florida to use the Baker Act, involuntary admissions, for what it was intended for. And because there's been an absence of resources that are immediately available in the middle, I think that many people have been talked into meeting the criteria of a Baker Act when they were not necessarily conditioned crimson red. Like they've been talked to say, do you want to harm yourself? Do you want to harm anyone else? You ever thought about suicide? To the point where they at least say the bare minimum, and we've stretched that law to get them involuntarily admitted, only to become frustrated because by the time the police officer gets their paperwork done, they're released. They're released because they were never intended for what the Baker Act was intended for in the first place. So I think that there's a lot of work that we can do in that space. And then the last comment on this is society as a whole, if they had not experienced this, there's this assumption that if somebody is involuntarily admitted, surely by the time that they're released, they're okay. And I tell people, look, if they've gone in involuntary, let's call that crimson red. They're only a lighter shade of red when they come out, and they need resources during that vulnerable stage in their life.
Absolutely. So we have some questions from the audience. Governor DeSantis and First Lady Casey DeSantis have made mental health and substance use a top priority. And this is for any one of you. How has that helped change the discussion about seeking help for mental health challenges?
Well, I can start. I can say that First Lady Casey DeSantis has almost single-handedly broken the stigma. She has just been a champion and has made everyday conversations okay and normal. People talk about mental health around the dinner table. People talk about mental health or depression, anxiety in their offices if they're back together, in the grocery store. Those conversations didn't occur just a very few years ago, and we make the point that even legislatively, when we would go in to meet with legislators, they, as soon as you said mental health or substance use, they were headed to the door or their eyes glazed over and were very uncomfortable talking about it. But now, 1 in 5 individuals have a mental health diagnosis. We see that almost every family in our state has been impacted by substance use disorder, whether it's alcohol, opioids, or some other substance. And so, it becomes real for all of us, and it's something that we can share together and work on together to be able to meet head on.
Yeah, and just to follow up on Melanie's comment, I will tell you, I've been so incredibly impressed with the passion of the governor and the First Lady. I know that Melanie and I both worked on the state opioid task force that the governor put in as an executive order as soon as that happened. And it is amazing the amount of times that First Lady Casey DeSantis has called me on the phone and had more than an hour-long conversation about mental health programs, substances, her effort of the facts, your future, and all of these things that she's doing, talking to families, but specifically having a focused attention on our kids. And I think that we heard that alarming stat of nearly 25% of our kids have seriously contemplated suicide. So they've done that, and they've also leveraged financial resources that are moving in that direction. And for those who have not done it already, one of the things that we did here is we partnered with healthcare providers here locally. We had the private companies come in and write big dollar checks. The Florida legislature, under the leadership of the Speaker and the Senate President, has given us now $1.2 million in appropriations when we're receiving some federal support as well. But we're incentivizing programs that actually work in people who are going to do the space, and their leadership has been nothing short of remarkable.
Kimberly, I just wanted to add also that the governor and First Lady ensured after Hurricane Michael that resources were put toward specifically providing mental health services to people who were impacted. And now they've done the same thing for people impacted by Hurricane Ian, is making sure there are financial resources available to ensure people have access to mental health care.
So following the shooting at Marjorie Stoneman Douglas High School, there have been several grand jury reports. I'm sure you've all seen them. The third one referred to the sad state of mental health care in Florida. Is what can policymakers do? We're coming up on session now. What bills can they propose? What do we need?
Well, we've got a legislative effort right now, and we've got some sponsors that are going to carry various bills. I think what we have to do is we have to define that area that is between somebody who's in a critical state of crisis that is qualified under the Baker Act, and just somewhere on the spectrum of crisis where they're in need of service, but then policing professionals that are likely to come in contact with these people initially have very few resources to provide them healthcare and services, right? If they're not voluntarily going, it is so difficult to try to convince somebody if you don't have that loved one or that family member. For those situations where you're dealing with people who are younger or who have the support of family around them, it's a little bit easier because you can talk to loved ones that have a sound foundation and can help connect the dots between treatment, healthcare, and services. But for those that are living in homeless camps, where you don't have enough to arrest somebody, you don't have enough to bake rack somebody, I think that legislatively we can do more in that space to get people to treatment facilities and in front of licensed caregivers without detaining them and taking them against their will. And then lastly, I think a big push is making sure that we have greater access to assisted outpatient treatment, that is reachable. And we are still a state that has probably no likelihood of looking down the path of expanded Medicare and Medicaid, but we can close that gap in because the private companies and private sectors, once they identify the problem, they're willing to contribute to this. Many people who are suffering in crisis, like Melissa talked about, if she came into work looking a little bit differently, a lot of people who are in the early stages of crisis are identified through their employer. Sometimes it's treated like it's a behavioral issue or performance issue. And the EAP systems across the country have been less than desirable in many regards. And I think beefing up actually employee-based services for those members when we first see them is something that's incredibly important.
And I do want to give a little shout out to Lakeland Regional Health here. We have recently opened a $64 million facility to help treat and house in one building people in mental health crisis. And they also do outpatient therapy there as well. So, I see some changes going forward in the right direction. And again, I do want to ask if you see anybody who is struggling, what can you do to help them?
Melissa, I was kind of waiting on you to respond to that, but no, if you see someone that is struggling, really just reach out and start a conversation. It can start at a very, very low grassroots efforts that just says, hello, how are you? How are you feeling today? And be sincere about it. Maybe you pick up the phone and call someone that you haven't spoken to in quite a long time. Maybe it's a family member or a close friend. Maybe you send them a text. We know that kids like to text and use Snapchat more than they have a conversation on the phone. But it's just that reaching out and that human touch that helps to begin the healing process and helps us to be able to deal with some of the issues that we face. Obviously, if there are deeper symptoms, to refer them to a professional. There are helplines available from all of our community providers. There is the 988 line. There is the First Lady has her Hope for Healing and her Hope Florida websites that contain an enormous amount of information and a direct path to be able to get help. You can talk to your local community health mental health professionals, and they can help as well. I would like to say too that, in terms of legislation, the mental health system and the behavioral health system of care, it may have components that don't work well, but overall it's been neglected for many decades. And under the leadership of Governor DeSantis, the legislature has made significant investment, $126 million last year in recurring GR, just unheard of. We've not seen that sort of investment in many, many decades. For school mental health, after Marjorie Stoneman Douglas, an investment of $100 million. Now it's up to about $130 million to address the needs of our school children, to address the needs in our community. And so we would certainly hope that those efforts continue. We need to look at prevention so folks can be prevented from coming into a crisis situation, look at crisis care, look at that outpatient, those community supports like recovery community organizations that support those with substance use needs, look at the intersection of criminal justice and mental health, and to be able to support programs that deal, behind the fence or that are in jail, so that when folks are released, they can have those community supports that are there, as well as the problem-solving courts to be able to direct individuals into programs rather than into incarceration. So there's lots that can be done, and we are in a really, really fortunate time to be able to make some impact in our system of care.
Well, Melissa, Melanie, and Sheriff, it's time to wrap up, and we want to turn it back to Mike Jones for some closing remarks.
Thank you, and thank you to our panelists for a really insightful discussion. I personally learned something. I wanted to make a comment. There was a question earlier about the governor and the First Lady making this a priority, and I just wanted to add that as a result of that, it's brought mental health and behavioral health issues to the forefront of the conversation, where years ago we weren't having these types of conversations. And I think, at least for those of us in the health insurance industry, it's really brought awareness to highlighting the need that is out there, and then also helped us in terms of really looking at the whole person and understanding how to treat the whole person rather than just their physical health needs. And so really appreciate the insight and the discussion today. And I'd also like to thank you, Kimberly, for facilitating such an insightful discussion. It was very, very interesting, very thought-provoking. So thank you.
Thank you.
And with that, I would also like to thank our attendees for joining us today. Thank you for your participation and sitting in on this conversation. If you'd like to learn more about Molina's work in the community, you can by visiting www.molinacares.com/Florida. Again, thanks everybody for your participation, and have a great day. Thank you.
Thank you.